Good morning, everybody. I am Professor Alexis Heng from Peking University, China. Today, I will be talking on the counseling of elective egg freezing patients considering donation of their unused surplus frozen eggs for fertility treatment. So, why is this topic of interest? This is because in recent years, there have been a sharp increase in the numbers of women freezing their eggs worldwide. Numerous studies, particularly in the USA, UK, and Australia, have shown that most women who freeze their eggs do not eventually use them. This in turn has led to an accumulated surplus of unused frozen eggs in IVF clinics worldwide. It would simply be a waste for women to discard their eggs. At the same time, there is a rapidly growing demand for donated eggs worldwide. So these unused surplus frozen eggs can thus be donated to IVF patients in need. Okay, before talking further, let me give a brief introduction of myself. I obtained my bachelor's degree from Imperial College, University of London, my master's degree from the National University of Singapore, and my PhD degree from the University of Manchester. I am both a biomedical scientist as well as a bioethicist, and am currently based at Peking University, China. Besides publishing about 70 articles on bioethics, I also have over 300 scientific publications with an academic H index of 59. One of my key areas of research interest within the field of bioethics is on elective egg freezing. Listed here are some of my relevant publications on elective egg freezing. For example, I recently published a paper in Asian Bioethics Review last year in 2023 entitled Counseling Elective Egg Freezing Patients Considering Donation of Unused Surplus Frozen Eggs for Fertility Treatment. Besides this, I've also produced another two papers on counseling. One of these is entitled Systematic Protocol and Methodology Needed for Pre-Procedure Counseling of Elective Egg Freezing Patients in Singapore, which was published in the journal Human Fertility also last year in 2023. Yet another of my paper on counseling is entitled Post-Procedure Counseling is Recommended for the Disposal, Export, and Donation of Unused Frozen Eggs for Research or Teaching Training, which was published in the Journal of Assisted Reproduction and Genetics earlier in 2022. At the same time, I also approached the topic of the regulation of unused frozen eggs in a paper entitled Singapore Needs to Update Regulation of Frozen Egg Donation After Permitting Social Egg Freezing, which was also published in the Journal of Assisted Reproduction and Genetics. At the same time, I was also interested in the compensation or reimbursement of former elective egg freezing patients who had donated their eggs. So I published an article entitled Subsidies and Reimbursement of Medical Fees, revisiting the old concept of egg sharing donation in elective egg freezing, which was published in Fertility and Sterility News in 2023. It is imperative for us to understand the background of why women freeze their eggs. This is thus summarized by the flowchart presented in this slide. It must be noted that this flowchart is based on the Singaporean context. It must be noted that many women face much doubts and hesitations during the process of egg freezing. For example, the egg freezing procedure is associated with various health risks and its success is far from certain. Then some women may face social and family pressure to have a child rather than of their own personal desire. Moreover, the cost and the effort involved in egg freezing may be prohibitive for some women. So the key question is, why do women freeze their eggs? What exactly motivates them? This, in fact, can be broadly categorized into two areas. Firstly, they may have not yet found a suitable husband or partner for child rearing. And secondly, they are not mentally, emotionally, and financially prepared to have a child. For women who freeze their eggs because they are unable to find a suitable husband or partner for child rearing, the question that arises is that what if they are still unable to find a suitable husband or partner in the future? A time will come when they will need to decide on what to do with their frozen eggs. The problem is that in a country such as Singapore, there are strict laws on the utilization of frozen eggs. Currently, Singapore law prohibits IVF treatment with donor sperm for single women. So, women with frozen eggs who remain single are left with two choices. Firstly, they can discard or donate their unused frozen eggs, which would mean a wastage of their hard earned money and also despair over unfulfilled parenthood dreams. Secondly, they can export their frozen egg overseas for donor sperm IVF. Although the single women may achieve motherhood, they may face the social stigma of single motherhood and be excluded from various government pro-family incentives as well as other legal discrimination against single mothers in Singapore. For women who freeze their eggs because they are not mentally, emotionally, and financially prepared to have a child, there could be a number of underlying motivations. For example, some women may want to prioritize their career advancement. In that case, they have to trade off between extra time and lesser chances of motherhood with egg freezing. Other women freeze their eggs because they want to build up their finances and save money in view of the high cost of child rearing. Then the question that they have to ask themselves is that what if there's no change in their financial situation? And they must also consider inflation and the rising cost of living over time. Then there are yet some other women who may want to extend their child-free life due to lifestyle pursuits such as traveling. And such women may face criticisms and disapproval by family and friends. In reality, in the overwhelming majority of cases of women freezing their eggs, they are motivated by the need for more time to find a compatible husband or male partner for child rearing. In fact, this was stated clearly in a book entitled Motherhood on Ice: The Mating Gap and Why Women Freeze Their Eggs, which was authored by Yale University professor Marcia C. Inhorn. In almost all countries, women graduate from university at a significantly higher rate than men. As a result, many educated professional women find difficulties in finding a compatible man that match them in terms of education and earnings. Indeed, because female hypergamy is deeply entrenched in all human societies, and all women want to marry men that are smarter and richer than themselves, the shortfall of university graduates among men thus create difficulties in finding a compatible life partner for many well-educated women. This is the major driver for the rapid increase in the number of egg freezing cases worldwide. It must be noted that most women who freeze their eggs do not eventually use them. About 80 to 90% of egg freezing patients will not use their frozen eggs. Of these, 25% to 30% choose to donate their surplus unused frozen eggs for fertility treatment of other patients in need. It is thus predicted that around 20% to 25% of eggs being frozen will eventually be donated for fertility treatment. So why? Why do so many women who freeze their eggs do not eventually use them? This can be attributed to a number of factors, including the fact that many women conceive naturally after the egg freezing procedure. Then there are also women who have frozen their eggs but have given up on motherhood aspiration due to number one, advanced age not practical for motherhood, number two, inability to find a suitable partner spouse for child rearing, and number three, do not want to pursue single motherhood with donor sperm due to social cultural factors such as religion within their family or community. Now let us go through the ethical background on why we need rigorous, systematic, and comprehensive counseling protocols for the donation of unused surplus frozen eggs. This is because the process of decision making on what to do with one's unused frozen eggs is often an emotionally draining and heart wrenching process. After having invested so much time, effort, and money in the egg freezing procedure. So there are a number of options for women on what to do with their unused frozen eggs. Firstly, to discard or destroy their frozen eggs. Secondly, to donate to research or teaching training. And thirdly, to donate to IVF treatment of other patients who need egg donation. Egg freezers often grieve over their lost chances of motherhood due to inability to find a suitable partner for child rearing or because their advanced age makes motherhood impractical and undesirable. For those who consider donating their unused frozen eggs for the IVF treatment of other patients in need, there's a fear of unexpected future contact with their unknown donor child, which could be due to donor anonymity being abolished in their own country or because of widespread consumer DNA testing and associated genealogy websites that have made donor anonymity obsolete. Here are some key ethical requirements of the counseling of former elective egg freezing patients considering to donate their unused surplus frozen eggs for IVF treatment. First, the counseling protocols must not encourage donation to enable autonomous decision making. Second, counseling should be neutral to the patient's ultimate decision. Third, counseling should not be focused on the needs of others other than the patient sitting in front of the counselor. Fourth, truly unbiased and comprehensive counseling should include the facts about all possible disposition options as well as discuss patients' feelings related to those options. Fifth, patients must be given enough time to make a decision. Preferably, there should be a hiatus of 1 to 2 weeks between counseling and signing of donation consent forms. Six, patient's partner or spouse should be involved in the counseling process and a joint decision should be made in signing the donation consent form. In developing counseling protocols for the donation of unused surplus frozen eggs, it is essential to take note of the key differences between elective egg freezing versus conventional egg donors. Firstly, elective egg freezing donors tend to be much older than conventional donors at the time that they are considering donating their unused surplus frozen eggs for IVF treatment. This would thus drastically reduce their chances of conception after donation. By contrast, conventional egg donors tend to be much younger women with many more remaining years of fertility. A two-step counseling protocol is thus proposed. Step 1. Verify and ensure that elective egg freezing donors no longer want to use their frozen eggs to conceive a child in the future. Step 2. Discuss the various motivating and dissuading factors in the donation of unused surplus frozen eggs and present other disposal options. Now let us go through step 1 of the protocol. It is imperative to verify and ensure that elective egg freezing donors no longer want to utilize their frozen eggs to conceive a child in the future. and they should be encouraged to discuss and the various underlying reasons with their fertility counselor as depicted in the flowchart. Now, let us go through some of the reasons why former elective egg freezing patients no longer want to use their frozen eggs. It could be that their age is no longer suitable for motherhood, or their current spouse or partner may not want a child. Then there are also changes in personal, financial, or family circumstances that are not conducive to motherhood. Moreover, some former elective egg freezing patients may have developed medical problems that make pregnancy and childbirth risky. For those who have already achieved motherhood, they may be completely satisfied with the current number of children that they have. For those who are childless and have given up on motherhood aspirations, this could be because they are unable to find a suitable spouse or partner and they do not want to pursue single motherhood. Moreover, some local jurisdictions ban sperm donor IVF treatment for single women, as in the case of Singapore. It is imperative that counselors be acutely aware of the differences between elective egg freezing donors and conventional non-patient egg donors. Firstly, elective egg freezing donors tend to be much older women so that they have much lower chances of conceiving after donating their eggs and therefore must think more carefully about their decision. Secondly, elective egg freezing donors will have spent much money, time, and effort in egg freezing, and so may be emotionally stressed at having to decide whether to discard or donate their frozen eggs. And there could be a perception of wastage. Now, let us go through the second step of the counseling protocol. A frank discussion should be carried out with elective egg freezing patients on the various motivating and dissuading factors in donating their unused frozen eggs as depicted by the flowchart. Other options for disposal of the unused frozen eggs should also be presented to the patients. So besides donating their eggs for IVF treatment, the patients can discard or destroy their frozen eggs, donate to research, or donate to teaching or training of laboratory personnel. Now let us discuss some of the factors that dissuade former elective egg freezing patients from donating their unused surplus frozen eggs. These include the fear of accidental incest and risk of genetic sexual attraction among unknown donor offspring. Then there's the hassles and discomfort of infectious disease testing and genetic testing that will be required for the donation process. Moreover, some elective egg freezing donors may fear future regret and psychological problems of being unsure of whether an unknown donor offspring exists out there. Then there's also fear of future contact with unknown donor offspring due to the absence of donor anonymity or widespread consumer DNA testing. Moreover, some elective egg freezing patients may also be discouraged by the fact that they are obtaining no obvious benefit from the altruistic donation process. Moreover, some elective egg freezing patients may face disapproval of their spouse or partner or other family members in donating their eggs. Or perhaps their religion does not permit egg donation, or there may be cultural specific factors that are not conducive to egg donation. Some motivating factors for former elective egg freezing patients to donate their eggs include reciprocity in wanting to share the joys of motherhood with other women via egg donation, or simply goodwill to help other infertile patients, or to avoid wastage of their frozen eggs after spending so much time, effort, and money in the egg freezing process. Moreover, Some IVF clinics may offer reimbursement or refund of medical fees in return for donation of their unused frozen eggs. Now, let us go through some of the key issues that elective egg freezing patients should consider before donating their unused frozen eggs. Firstly, there are additional hassles of infectious disease screening and genetic testing that former elective egg freezing patients must go through during the donation process. Although most of them will have undergone a first round of testing before starting the egg freezing procedure, most IVF clinics would in fact require them to undergo a second round of testing before the donation is permitted. Second, elective egg freezing patients should consult and discuss with a husband and other family members before donating their eggs. This is because most elective egg freezing patients at the time that they are considering donating their eggs are older women. Many of them past the age of menopause. Therefore, the frozen eggs represent their last chance of having more children. And so it is very crucial for them to discuss with their husband on this very important decision of donating their eggs, because once the eggs are donated they can no longer turn back the clock and have more children. Third, there's also the chances of accidental and unintended incest between the unknown donor offspring and natural children of the donor. Yet another issue to consider is whether former elective egg freezing patients get compensated for donating their unused frozen eggs. Then there's also the possibility that the unknown genetic child, the unknown donor offspring, might contact the egg donor, particularly if egg donor anonymity have been abolished in their jurisdiction. Then there's also a possibility of future regret if the elective egg freezing patients have donated their unused frozen eggs as a childless woman. Here are some recommended disclosure of information to recipient patients. First, recipient patients should be informed that IVF success rates with frozen donor eggs are significantly and consistently lower than with fresh donor eggs. Second, recipient patients should be informed of the number and sex of children that the elective egg freezing donor already has, or whether she was childless at the time her frozen eggs were donated. Third, recipient patients should be informed whether the donated batch of frozen eggs by the elective egg freezing donor has been divided up and allocated to multiple recipient patients, regardless of whether any children have already been born from the donated frozen eggs. Last, recipient patients should be informed whether the elective egg freezing donor has declared any relevant health problems to the fertility clinic. Here are some suggested additional safeguards. First, elective egg freezing donors should have the right to withdraw their consent at any time before their donated frozen eggs are used for IVF treatment. Second, medical professionals who had previously performed the egg freezing procedure on prospective elective egg freezing donors should not be the ones soliciting and encouraging egg donation from their former patients to avoid potential conflicts of interest and prevent abuse of the doctor patient fiduciary relationship. Here is my non academic bibliography that are magazine and website articles. The website links of these articles are presented in this slide. So on the Malaysian Health website known as Good Blue, I've published two articles. The first is entitled Key Issues to Consider Before Donating Your Unused Frozen Eggs, while the second article is entitled Considering Single Motherhood by Export of Frozen Eggs. At the same time, I've also published two Straits Times Forum articles. The first is entitled Consider Donating Unused Frozen Eggs to IVF Patients, while the second article is entitled Mandate Counseling for Women When They Decide What to Do with Unused Frozen Eggs. Additionally, I've also published an article on the BioAge website entitled Singapore must prevent abuses in donation of unused surplus frozen eggs. Thank you very much for listening to my talk. Please feel free to ask any questions and have a good evening.